So essentially what I presented on had to do with the JCAR017 phase 1 clinical trial, which is JCAR017 is a type of CAR T cell that targets CD19, which is on B lymphocytes. And the trial is being done in patients with aggressive B-cell non-Hodgkin lymphoma, especially diffuse large B-cell lymphoma. And the actual results of the trial are going to be presented on Monday, so I can't really talk about those at this point. But what I presented on yesterday had to do more with, can we identify biomarkers or patient characteristics ahead of time before the patients actually get treated with these CAR T cells in order to see who is the patient who will go on to develop or is at a higher risk of developing toxicities, side effects, maybe responding, not responding, et cetera, and whether or not we can then tighten up the eligibility of our trials to kind of get the ideal patient on and have them get to the best responses ultimately. What we found was that patients who have a very high burden of disease, so a lot of lymphoma at the time of starting therapy, or just before starting therapy, as well as high levels of something called LDH, which is a marker of more aggressive lymphoma, more rapidly dividing tumor cells. And then also if they had a lot of high level of cytokines or inflammatory markers in their bloodstream at the time, it turned out those patients were the ones who went on to develop more specific side effects of CAR T cells, like cytokine release syndrome and neurotoxicity. And even though the total number of rates of these side effects in this trial have been low, so out of about 92 total patients thus far who are evaluable for safety, only about 30% have had any grade cytokine release syndrome, and 20% have had any grade neurotoxicity. However, it turns out that the patients who actually did develop these side effects were the ones who had that higher burden of lymphoma at the outset and higher LDH, higher cytotoxic levels. So if there's a higher inflammatory state in the body, it turns out those patients may be the ones who are at risk for developing toxicities. The other thing we found was when people have a lot of tumor burden at the outset and a lot of cytokines and inflammatory state in the body, when we give them these CAR T cells, those patients expand these CAR T cells the most in the body, and that's kind of what you want, because when these cells expand in the body, that's when they can fight a lot of lymphoma. But if they expand too much, this trial seems to show that they may not be able to hold on to their response, because at the 3-month mark after treatment, some of these patients were actually either not responding at all, or they were actually losing their response before they hit the 3-month mark if their cells expanded too much, being a very higher inflammatory state to begin with. And so what we're trying to figure out, what I showed in the presentation, was there's sort of a bell curve and there's sort of a sweet spot in this CAR T cell expansion. So if patients expand too much, they may not do so well. If patients don't expand their cells enough, they may not do so well. So how can we get these patients, how can we identify these patients first and then get them into this sweet spot so that we can achieve the holy grail of like everybody having a good response or a durable response ultimately?